Hello, future Rossies and pre-med explorers. This is Milena Garcia, your host for Ross University Checking the Pulse, a pre-med podcast. This is our mini podcast featuring facts and information about our medical program, insights from current students, and tips from practicing physicians. Each week, this broadcast will be broken down in small episodes, focusing on one aspect of our program, also having guests talk about their own experiences as students and as doctors. Burnout in medicine is not a new concept. It's been lurking around in the background of the medical profession for a long time. Thankfully, there has been much more deserved attention dedicated to it recently. It can start in medical school and directly impact the student's physical and mental health, as well as their academics. In this episode, we will hear about some of the initiatives Ross University School of Medicine offers to help the students avoid this burnout.
Well, welcome back, everybody. Thank you for joining us. This week, my guest is Dr. Lori Helgo. She's a clinical psychologist and associate professor of behavioral sciences here at Ross University. In addition to being an educator, Dr. Helgo is an internationally acclaimed author and public speaker with a special interest in the relationships between personality and culture. She's written books about narcissism and introversion, and she's been interviewed and quoted internationally. And she finds the time to paint. Dr. Helgo, thank you for joining us. We appreciate it. Please, let's take a moment to have you introduce yourself to our audience.
Thank you so much, Milena. I am happy to be here to talk about burnout. And in fact, that when I reflect, really that is kind of a start of my journey that got me to Ross. I wouldn't have known it at the time, and it took me several years, maybe decades. But I practiced as a psychologist for a good part of my career, and was working in a busy clinic when I actually went through my own psychoanalysis as a part of my training, as well as my own mental health maintenance. And I was in a session and I found myself saying, I don't like my life right now. Oh, wow, that's a problem. I'm still paying off student loans and I don't like what I'm doing. And it wasn't that I didn't love the field of psychology, because I did and I do. But it was because my career had become rather one-dimensional, and I found that I needed outlet for both learning and teaching as well as practicing, and Ross University has really given me that outlet. So I'm able to do both the consultation with students about their clinical skills and bring my psychology background to that. But I also get to think and teach and consider ideas. And that creative part of what I do is very important to me.
And it's a pleasure to have you with us. We appreciate you taking your time and to bring attention to this very urgent topic of burnout in medicine. Dr. Helgo, what is burnout in medicine and why is it important to take notice?
Well, one of the definitions of burnout that I find compelling, perhaps a little depressing, but it is, I think, very attention-getting, is that it is a kind of erosion of the soul. It is, and in fact, my own experience, I can attest to this, it is kind of becoming one-dimensional. We become just what we do. So there's three facets of burnout we look at. One is emotional exhaustion. You are putting yourself out, you're giving, and at some point you're not getting replenished. There's nothing left. And it's different than physical exhaustion. You may have that as well, but it is more this sense of not being able to restore yourself, restore your energy, your drive, your passion for what you do. So emotional exhaustion is one facet. Then there's also depersonalization. And this is very sad because none of us feel good when we see ourselves experiencing this. But this is kind of go ahead and tell me your sad story. I don't care. It is the seeing a body and not a human for doctors. It is a cynicism, a sense of, when we find ourselves depersonalizing, we are more likely to need to vent about patients or colleagues, and we are really detached from what it is that we're really here to do. And then the third facet of burnout is a sense of a lack of accomplishment. And along with that comes a loss of meaning. So, it's kind of what's the use? What am I doing here? I don't care. Or I can't do any good. So there may be, and it's very easy in the medical profession and in medical studies to get to that point where you feel overwhelmed, where you feel very small in relation to what you have to know or what you need to, the need out there. And that can become overwhelming. So we look at those three dimensions as signs of burnout.
And when do you see the signs start showing?
Unfortunately, we see it pretty early in medical education. Students who come into medical school aren't really that much different in terms of mental health than students going into other graduate professions. But the process of being in medical school threatens to degrade mental health. So we see depression 2 to 5 times more prevalent among medical students than among their same age peers. We see increased levels of anxiety, and certainly the burnout can definitely happen in medical school. So all those symptoms can become apparent even before you become a doctor.
And what are we doing here at Ross University to reverse this trend?
So that's what excites me, because I think that's part of what became the ultimate fit for me, is that I have studied self-care throughout my career. I've been my own patient in a sense in that regard. And I think the medical profession is very, very good at having a service orientation and outward focus. And these students are amazing in their commitment to service and into making the world a better place. What often can be missing, unfortunately, is pointing that back at themselves and looking at what they need. So at Ross, we have a number of resources. One is our Wellness and Counseling Center.
Which in fact, I'll do an episode on them specifically. So good idea. Thank you.
Yes, that's great. And they are wonderful. And in fact, have expanded what they provide beyond counseling to coaching services. So they really try to always be looking at the needs of our students. They do mindfulness workshops, test anxiety workshops. So they have a lot going on. And they have been a staple at Ross for sure. So I'm glad you're featuring them.
What a great idea. Yeah. So everybody check back. We'll do an episode entirely on the counseling center.
Yeah, fabulous. So, and then newer is something we're calling the Mind Body Medicine Initiative. Mind Body Medicine isn't our label. It comes from the Center for Mind Body Medicine. And I went through their training. I have colleagues who have been through that training or are going through it. And what we provide in second semester, and we're just rolling this out for more and more students. It's in the pilot stages now, is an 8-week small group, 2 hours a week, that just allows students to step away from school and studying and talk with other students about what it is they're experiencing in the moment. Which is not, it seems like a simple thing, but we often don't pause to ask that. So that's part of it, and that self-awareness and that sense of sharing and community that develops from that. And then we also have an experiential component where we learn together and practice a mind-body skill. So that may be contemplative meditation. Doesn't need to be the lotus position. I can't do that. So expressive meditation, mindful eating, use of writing. So there's a number of skills that a different one taught every week and experienced. And then between sessions, we practice and we make discoveries about what works for us.
Can you tell us a little bit more about the Mind Body Initiative?
Yeah, so once that students have been through that program, another exciting component of that is that they then are eligible to become Mind Body ambassadors. And so then they share with other students their skills. And a good example of that was not only with students, but with colleagues, faculty, and staff. On National Physician Suicide Awareness Day, the Mind Body ambassadors held an observance where we had a moment of silence to honor those we have lost, but also they led us in some deep breathing and some shaking and dancing. And I had a colleague, a dean, who said this was the most relaxed he had ever felt in the middle of a workday. And it was just a very powerful session. Students and some faculty shared from their experiences. And I think all of these things are part of changing the culture of medicine so that we're not just about being omnipotent, all-knowing healers, but we are also humans who have stories to tell and have and need to be replenished and need connection.
And as you know, I was a participant as staff. I participated in the Mind Body Medicine that was available to us a couple of months ago, and really could see the results, even though I couldn't really explain how. But we all felt less alone, I think, was the mutual feeling. So I know it worked for me. What about for the students? How do we measure the benefits, or are you measuring the impact it has on our students?
Yeah, I'm glad you asked that. We are actually engaged in a study. The first phase is a pilot, so we're just using focus groups, talking to students who are in it or been through it, talking to colleagues. I went through the group as a part of my training. I've been in a couple groups. And yeah, so we're trying to really look very closely at what the benefits are of this. And we have some theories about that. There's some evidence. But one thing that's really exciting is that we will be conducting the first randomized control trial of mind-body medicine in a medical education setting. Wow. And so that should be a big contribution to the conversation right now, because medical schools all over are adopting these kinds of groups to help the students. But I can say, just in terms of what we're observing, what students have talked about self-awareness as being one benefit. And one thing that is unique about these groups, and I think it speaks to what you shared, Milena, is that ability to tell your story, share whatever it is going on. Nobody's interrupting you and nobody's fixing you. People are just bearing witness to what you say. And when they share, they talk about their own experience. And what we find is that, oh my gosh, you just said exactly what I'm experiencing. And when people make those connections, it is life-changing. Because especially with medical students, there tends to be a lot of posturing. It's like, yeah, piece of cake or whatever, Either we have two streams. We have like the posturing, like, there's that culture of competition, or we have the other extreme, which is that kind of a bragging about how burnt out I am and how, overworked I am and what a martyr I am, and neither of those tell the whole story. And this is, I think, a forum where we really get a kind of underneath the surface of those kind of positions that people tend to take.
Mm-hmm. I felt it personally. I feel like you're talking to me about me. And it worked. I don't know how. I don't have the scientific background to justify and explain like you have, but I tell you, it worked. We always think that prevention is better than remediation, right? Is there a way to avoid this? How do we become burnout proof? Is there a way to avoid it? And how do we help our students become burnout proof?
Right. So I think that there's not a way to avoid any of the symptoms of burnout. I think that I think you can. I mean, there are probably some mindfulness gurus out there who really can stay in this centered place all the time. But I think more realistically, we get thrown about a bit. But I think what makes us burnout proof is self-awareness. It is being able to notice the signs. It's a part of emotional intelligence to be able to tune into what it is you're feeling. That certainly then can translate to your ability to pick up on the feelings of a patient, for example. If you know how to respond to yourself, that's the starting point. So it is really, I think, that self-awareness to that, yeah, I see that I'm becoming cynical. I see that, I'm complaining all the time about everybody in my life. I see that the joy is gone. Okay, time to pause and see what needs shifting. So I think that's a big one. I think the ability, and that mindfulness is a buzzword now, but I think it is really about being able to actually see what's happening in the moment, and to distance ourselves a little bit from the noise of what goes on in our heads.
And it's nice that medicine is finally taking notice of this urgent need. Do you have any tips on how to manage the stress of medical school?
Yeah, and one is behind me. So I do painting, and I didn't intend this as an object lesson, but it kind of is, because when I'm painting, it is a form of mindfulness, because when I'm in my head, and I live there a lot, I don't see what's around me. And when I paint, I have to actually look at what is on there, what's in that photograph. And it's often not what I think it's going to be. Faces have all kinds of colors in them, and lines that you don't necessarily notice because you're looking at the whole thing. And so I think that becoming curious about all there is that is out there, there's a ton of resources and little tips, little ways of doing MIDI mindfulness exercises through the day. Becoming curious about that, just as you are also curious about medicine, is going to be kind of set you on a lifelong adventure with self-care. The other thing, and it's related again to my painting, is my paintings remind me of this, is that there is not to let go of your non-medical interests. I mean, there is a danger, and it happened to me when I was in this busy clinic. I was exercising one muscle, is becoming one-dimensional, and that is a real risk. For one thing, when we're heads, and the learning experts will tell you this, when your heads are always in your books, your head starts to get muddled. You lose perspective, and you actually become less efficient as a learner. So beyond that, there's evidence that suggests that engagement in the humanities is related to less burnout, which is fascinating. So this excuse that I don't have time to paint, if you're interested in theater, if you're interested in music, I have students, hip hop dancers, and students have interest in fashion. I have students with, it's one of the first questions I ask them: what are your non-medical interests? student today was telling me how she and her husband go boxing. They have a boxing gym they go to, and they love punching the, whatever you call that thing that hangs down.
A sandbag.
The bag, yeah.
This is their therapy or marriage counseling? Is that what?
Maybe both, right? Yeah.
For some of us is baking. For the others is punching.
Yes, baking is wonderful. Yeah, and another thing that can be very much engage the senses and help you tune into the present. Yeah.
Great. These are all great tips. Thank you so much for sharing with us. We really appreciate you taking your time. What about any last recommendations or advice for our future Rossies?
So, well, really, I think the students that I see thrive are the ones that stay joyful, that they maintain that fascination in medicine. And so sometimes it's work to do that when you're memorizing, all the muscles, you're trying to understand something very abstract, that's hard really to relate to but I think it is when you have that beginner's mind, and again, seek joy through other means. I mean, getting connected is very important with that too. There, in medicine now, in around the country, in the US, there's something called Meaning in Medicine groups. And the reason for that is that as long as you continue to connect with the meaning of what you're doing, that again is a prevention of burnout. And so I think that there are clubs, there are ways to connect with students through study groups. There are ways to stay involved in athletics, again, in the arts, whatever it is that helps you feel alive. Don't just expect somebody to do it for you. Attend to that.
Right.
Attend to being alive.
These are all great suggestions. Thank you so much for joining us. I appreciate you taking your time once again. And for everybody listening, thank you for joining us. We appreciate you, appreciate your time, and we will see you next week.
Thank you for listening to Ross University Checking the Pulse, a pre-med podcast. This is Milena Garcia, your host. This podcast is made for you, so let me know what topics you want us to cover on future episodes. You can send me your comments, feedbacks, and requests to mgarcia@rossu.edu. Definitely follow us on Instagram, Twitter, and our YouTube channel at Ross Med School, or on Facebook. If you're listening to this podcast on iTunes, I am working my way to 5 stars, so remember to send me your comments and let me know your ideas. If you're on Spotify, remember to click on the follow button to get our future episodes. All right, see you future Rossies and Pre-Med Explorers next week. This mini podcast is edited and produced by our in-house guru, Chris King.